Let me first acknowledge the leadership of the First Lady, Her Excellency Mrs. Margaret Kenyatta, and her convening of the 47 county governors as an excellent initiative by the Government of Kenya as it works towards accelerating attainment of MDG-5, reduction of maternal mortality, and advancing maternal health. When President Barack Obama and Secretary Clinton asked me to lead the President's Emergency Plan for AIDS Relief, PEPFAR, in 2009, I emphasized that although PEPFAR's programs have saved millions of lives in sub-Saharan Africa, there still remain significant challenges relating to prevention and treatment. PEPFAR, in partnership with the country, now treats 7.5 million of the 10 million people in sub-Saharan Africa receiving treatment. PEPFAR cares for 6 million orphans and vulnerable children. In 2013, PEPFAR's programs and countries supported 12 million HIV tests that identified 750,000 HIV-positive women to prevent 230,000 babies being born HIV positive in 36 countries. This has also resulted in, on average, a 45% drop in the number of new infections in 22 sub-Saharan African countries, a remarkable achievement that has been accomplished because of the leadership and implementation efforts of ministries of health and leadership like the First Lady of Kenya. As we tackle the many causes of maternal deaths, I would like to specifically highlight those related to HIV infection. HIV and AIDS have been known to cause the highest number of deaths among women of reproductive age, contributing about 20% of all the maternal deaths in Kenya. In other sub-Saharan African countries, the attribution can be as high as 40%. This is a trend that we can reverse if we concentrate our efforts and resources targeting high-risk populations with high-impact interventions. We already know many effective interventions, but we cannot implement them and make them accessible to those in need. From a recent analysis of the HIV situation in Kenya, it was revealed that 9 counties contribute to 65% of all new HIV infections. It is apparent that 6 of these counties are also faced with a high burden of maternal deaths, a double tragedy. While the current HIV prevalence has come down to 5.6%, some of these countries have nearly 4 times the national prevalence. It's estimated that out of the 425,000 born globally who become positive each year, there were over 13,000 Kenyan children who acquired HIV infection in 2013, having been exposed as a result of maternal HIV infection. Another way to say that is that for every 16 children newly infected with HIV in Africa, 1 child is from Kenya. We can do much better than this with strong leadership, strong planning, and strong implementation of already known interventions. The vulnerability of the adolescent and especially young girls to HIV infection cannot be overemphasized. The impact of HIV on this population has been compounded by the negative effects of unwanted pregnancies, unsafe abortion, other perinatal complications leading to high maternal morbidity and death. We already know how to prevent mother-to-child transmission. Our challenge has been in putting programs in place that are well interfaced with the target population of HIV-positive pregnant women and creating the medical system that can test, stage, and initiate antiretroviral therapy. I applaud Kenya for initiatives such as the Beyond Zero campaign by Her Excellency the First Lady, who has publicly supported maternal and child health programs by participating in public awareness campaigns such as marathon races both locally and in the international arena, the London Marathon this year, and launching health interventions like the recent expansion of HIV counseling and testing to targeted high-risk populations throughout the country, among others. However, to ensure effective movement to scale, delivery partnerships are critical. I'm pleased by the initiative taken by the United Nations Population Fund, UNFPA, together with Kenya's Ministry of Health and Kenyan Red Cross, to focus on 15 counties that bear the highest burden of maternal death. This is an illustration of a strong commitment towards the elimination of HIV transmission, especially from mother to child, And the Beyond Zero campaign has been effective in mobilizing world attention and bringing together all stakeholders, including those living with HIV, in a concerted and sustained effort to identify the critical elements that will drop maternal mortality and create a standard of care that is brought to scale, urban and rural. To have high impact in elimination of mother-to-child transmission, it is imperative to strengthen the integration of family planning into HIV services sites in order to address missed opportunities and increase the uptake of family planning services. Over half of the women living with HIV who would like to space their children do not do so, due to a myriad of reasons, some of which are inherent in our health delivery system. As a lead agency in this area, I urge and applaud UNFPA to continue its support to the Ministry of Health to strengthen family planning program initiatives. The strong partnerships established globally with PEPFAR, USAID, DFID, and the Gates Foundation need to be emulated in the county, leveraging resources to better the lives of the vulnerable and marginalized women and girls of this nation who are at highest risk of dying from pregnancy complications. I'm excited to also acknowledge the addition of a University of California, San Francisco preterm birth delivery initiative, supported by the Gates Foundation and the Benioff Foundations, that will focus on identifying the elements that drop preterm deliveries and maternal neonatal mortality in the perinatal period to define a standard of care that is effective, affordable, and sustainable. I would like to applaud this assembled group and the First Lady in challenging all of us to put our resources and minds together to think out of the box to aggressively create a standard of care that focuses on bringing all Kenyan women into care and services and allows them to have safe deliveries, allows their children to be born healthy at term, and to thrive. Thank you to the First Lady and to the conveners of this distinguished assembly for allowing me to address you today.